How does BCL2 translocation impact follicular lymphoma treatment? Imagine a tiny piece of your genetic code playing a big role in how a type of lymphoma behaves and responds to treatment. That's what happens with the BCL2 translocation in follicular lymphoma. Follicular lymphoma is a slow-growing form of non-Hodgkin lymphoma, and a common feature is a genetic change called the T14/18 translocation. This means a part of chromosome 14 swaps places with part of chromosome 18, leading to the overproduction of a protein called BCL2. This protein helps cancer cells avoid dying, which makes the disease more resistant to treatment. Most cases of follicular lymphoma, about 85 to 90%, have this BCL2 translocation. Doctors often look for this genetic change to confirm the diagnosis because it's so characteristic of the disease. However, a small number of cases do not have this translocation, and those might behave a little differently, sometimes needing extra testing to understand their biology better. The overexpression of BCL2 makes the cancer cells harder to kill with standard treatments like chemotherapy. Since BCL2 helps cells resist apoptosis, or programmed cell death, the disease can be more persistent. This is why follicular lymphoma has historically been viewed as incurable, often going into remission but then coming back later. Treatment usually involves a combination of drugs called chemoimmunotherapy. One key drug is rituximab, an anti-CD20 monoclonal antibody. Rituximab works partly by interfering with pathways that increase BCL2 levels, helping to make the cancer cells more vulnerable to chemotherapy. While this approach has improved how well patients respond, the disease can still relapse, and not every patient responds equally well. The presence of the BCL2 translocation influences prognosis but doesn't tell the whole story. It's a defining feature of follicular lymphoma, but it doesn't predict exactly how aggressive the disease will be or how well a patient will respond to treatment. Many patients live long lives with the disease, sometimes for decades, but others may experience more aggressive forms that are harder to treat. Researchers are working hard to find better markers to identify those high-risk cases early. In some rare situations, follicular lymphoma can transform into a more aggressive type of lymphoma. This transformation often involves additional genetic changes, like MYC rearrangements, leading to what's called double-hit lymphoma. These cases tend to have a poorer outlook and requiring more intensive treatment. Achieving complete remission after initial therapy is especially important for improving long-term outcomes in these high-risk cases. Scientists are also exploring new therapies that target the BCL2 protein directly. Drugs called BCL2 inhibitors are being tested in clinical trials and have shown promise in some lymphomas. However, these are not yet standard treatments for follicular lymphoma and are usually used in research settings or specific cases. It's important to remember that treatment plans are highly personalized. Factors like how advanced the disease is, a patient's overall health, age, symptoms, and other genetic features all influence the best approach. No single treatment works for everyone, so decisions should always be made with a healthcare team experienced in lymphoma care. In summary, the BCL2 translocation is a key genetic event in follicular lymphoma that helps cancer cells survive longer and resist treatment. While current therapies have improved outcomes, the disease often remains a chronic condition with the potential to relapse. Ongoing research aims to better understand BCL2's role and develop more targeted, effective treatments. If you or a loved one are dealing with follicular lymphoma, it's essential to work closely with your healthcare provider to tailor the best possible approach for your unique situation.